right, so I like to help you guys figure out how to use this book. If you don't have this book, please see the bookstore. They'll help you get it. The importance of this book is that it's going to help you do your care plan. It's going to help you with the nursing diagnosis, right? Because what is that? Nursing diagnosis is part of the nursing process, right? There is assessment first. So if you're doing your care plans for clinicals and you all of a sudden get to the point where you have to have a nursing diagnosis, this is where it's going to help. And the way it helps is you come into this book and you're going to search, you can search by medical, excuse me, medical diagnosis first. So for example, if I'm in here, you can come to this area. Okay, you start at the green. See the green tabs? And you search in here for medical diagnosis. Okay, let me see that. So let's say you've got a bone marrow biopsy going on. Okay, maybe that's a procedure, or maybe they've got blindness, for example. Anything in the bold print is a nursing diagnosis. Okay, think about that. Bold print nursing diagnosis. And then from there, you can go to the middle of the book and you go to, let's just say, let's go for example. Let me start with a fresh example. Let's say you're in clinical and your patient has a GI bleed, right? That's their admitting diagnosis, GI bleed. You need to come to the green part and look up gastrointestinal bleed. Okay, so I'm going to look it up. Gastrointestinal bleed. Hold on. It's going to be on page 57 in this old version that I have. You see here? GI bleeding, fatigue, fear, fluid, pain. Okay, see all that? All the bold? Those are the nursing diagnoses, different from medical diagnosis. So let's say for GI bleed, fatigue. You go to fatigue in the middle of the book here, you gotta find it. You go into alphabetical order and you go to the F. So I'm scrolling to the F. Where's the F? Come on, F. I'm looking for fatigue, fatigue, fatigue. Fatigue. Fatigue is a nursing diagnosis. Okay, this is important. This is how you're going to do your care plan. You see, fatigue, and it's going to tell you all about it. Definition, defining characteristics, suggested outcomes, right? When you do the evaluation part of the nursing process for your care plan, is the evaluation an expected outcome, right? And what about suggested intervention? And then at the bottom, you see all these things, EBN, okay? You see CEB. There's a difference. You've got evidence-based nursing practice, and then you have classic research, old school stuff. We go by evidence-based practice, evidence-based nursing, because it involves nursing research. Okay, it takes it goes back to all the way to when you were in middle school or high school years ago, and it says, hey, if you have a question, let's start a scientific method, right? You come up with your question, your hypothesis, your experiment, right? Remember that? That's where it's stemming from, because remember, nursing is a science and an art. This is the science part of it. Okay. And then you come over here, it has nursing intervention and rationales. This will help you with HESI, honestly. Because if you go into fatigue or fear or fluid volume deficit, people say, well, I've got a patient with cirrhosis. Okay. Now we need to go to cirrhosis, back into the medical diagnosis part. Now we're going to find cirrhosis. Okay. This is a great book. If you don't have it, get to the bookstore. You're going to need this. Okay. Cirrhosis. We're going to come in here and we're going to look for cirrhosis. So cirrhosis. You see that? And it says chronic confusion, coping, fatigue, right? Nausea, pain, self-esteem. Those are all nursing diagnoses. Okay. How are you going to put it? Well, nausea, you can put here fatigue related to malnutrition, right? You can put here nausea related to irritation to the GI system. It's all right here for you. Okay. Pain, self esteem, how does it relate to each other? And then you're going to go into the middle of the book and you're going to look for self esteem or nausea or whatever the nursing diagnosis was that you found under the medical diagnosis. So, for example, let's go to nausea, nausea. Here we go. Nausea. Nausea in surgery, nausea in chemotherapy, okay. Nausea. Right? It tells you what it is, the rationale, right? It tells you the biophysical situation, evidence-based practice. It tells you a lot of things, okay? It talks about methods to decrease nausea. So it could be an actual problem if the patient states that they're nauseated, or it could be a potential problem because if they're suffering from cirrhosis, right, then it's a potential they could become nauseated. Patient at risk for nausea, right? You can word it kind of creatively, but use this book, whatever version, doesn't matter the version, just get the book because that's going to help you do these care plans that your clinical instructors want you to do. And if you don't know how to use this book, then that's going to be a hindrance to your learning. So I'm highly suggesting this book. It's going to be a fabulous tool. What else can you gather from this book? Geriatrics, right? Maybe even if it doesn't matter RN, LPN, geriatric considerations are into this book as well. It's a wonderful book. You need this to do your care plans. All right. Short and sweet video today, nothing crazy. I hope this helps.